Hi, my name is Kelly Hindermeier. I'm an occupational therapist here at the OLET campus. I work mainly on neurosurgery and intensive care. Our issue in the whole rehab department is definitely a space issue. Here is our treatment room that we have mainly for the whole hospital. So therapists on other floors will bring their patients up here. It's limited because we store things, as well as we only have a couple of plinths, and so with this being a very busy hospital, it's often difficult to coordinate patients in and out. So you can imagine when each plinth is occupied, as well as the treatment space over there. Even sometimes we'll have patients over at our mock tub. It's quite congested in here. Most of our patients are in wheelchairs, so that accompanies them as well, and it just makes it difficult to coordinate patients in and out, and also keep it quiet while we have some of our brain injured patients trying to focus on what they're trying to do with therapy. As well as in occupational therapy, we store all of our wheelchairs in a room in the basement, which is often congested. This is our wheelchair storage room. As you can see, it's quite crowded. We have tried our best to make arrangements to have all of our wheelchair parts easily accessible. Oftentimes it's difficult to get wheelchairs in and out, especially if one's at the back of the room. All of these have to be sort of moved into the hallway so you can access the ones at the back. And when wheelchairs are coming in quickly, if there's been a lot of discharges that day, they all have to be siphoned in here relatively quickly, and it can get quite congested. My vision for a new hospital would be to have adequate treatment space and assessment space for all of us in the rehab department, particularly on each level of the hospital, including ICU, as well as having a large wheelchair storage area. For patients, it would mean easy access in terms of getting there quickly. A lot of our time is spent transporting patients up here and back. And as well, if they are very acute, they're on their floor where their nursing staff is. If something were to happen, patients pass out, they get sick, and if you're on a different floor, it can be a challenge to call up the nursing staff from that floor.